It's a wonderful evening, the 17th of April 2021, Academy of Orthopedic Manual Physical Therapists, official first collaborating partner, the Academy or the association or the group which was associated with the AOMPT to co-certify a course. It was none other than the passionate teacher who not only respects the teachers but also respects every student, because he learns from every student. And with pleasure, I also learned the cupping and the dry needling from sir. Okay, so it's a great honor for me. Although he tells that I am his teacher, and all those things, because we have been knowing right from Mangalore to, it's been a decade, more than a decade, 2 decades I think.
Yeah.
Okay, so we have been through with each other.
Since 2005.
Yeah, and it is a wonderful initiative that through ePlorus Healthcare, that sir is conducting the courses which are clinically relevant, and also that, please sir, you have come at the right time. Bunny. And with the Physio Sports Club also, that sir is doing a phenomenal job to ensure that the consultancy what he provides for the teams, and also the what is called as on-field training what he can provide to his participants. So really it is a great inspirational work, and the contribution of Dr. Mayank. Although he is given awards to many, he is also organizing the Purvanchal PhysioCon, and it was a master blast event. Okay, it was such a phenomenal experience to participate in that, and he always enjoys that as a student. Okay, even now when he listens to each other, and we keep always spreading the positivity to each other. It's always a pleasure to welcome him to the Center for Manual Therapy Education and Training located at Lakkere, Bangalore. It's always a pleasure to see that such a person who is an inspiring leader, because leader is not the one who is big. Leader is the one who makes others big. Okay, this is what I believe. And being a ladder is not an ordinary thing. For every teacher, a genuine teacher knows that they are ladders. Okay, they allow other people to climb. And you can be a best physio. I always tell everyone can be a best physio, but to be a great physio, you have to create best physios. Okay, so in that direction, as a resource person also, I get inspired from him that how a resource person has to be. Okay, so I am handing over the moment to Dr. Mayank Pushkar sir, and let him give his address as the chief guest for this certification course which is happening here, Neuromanual Therapy for Stroke Neurorehabilitation. Okay, so it's a certified NMT practitioner course, and participants are watching online, and they are also getting the materials, and they are getting the best out of interacting about patients. So this is what is the course that is ongoing. Over to sir. Yes.
Thank you so much, Sanjay sir. And sir has told lots of things about me, but what can I say about this sir? I know sir since like 2005 from Mangalore itself. Okay, and he was always a guru for me. And I still remember I have asked sir, why don't you take a workshop on my facial release? Because even I wanted to learn when I came back to Delhi after a long break, when I was there in Jharkhand in government job. After that I came to Delhi, so I wanted to learn new techniques. Though I have attended so many like manual therapy courses, but still that was lacking, which I felt. Okay, so I asked sir, I want to learn, and that's the reason I want to organize your workshop. Sir said, okay, fine, and we have collaborated with the ePlorus Healthcare, is my own healthcare company. So we have collaborated with this sir that time, and I have personally organized that workshop, and I have attended that workshop as a participant. Okay, so I still remember those myofascial release, and after that I am using myofascial release. Even I do talk about myofascial release in most of my workshop in the cupping therapy, because cupping therapy is basically associated with myofascial release. Being a physio, we use more in the case of myofascial release. And like there are so many times, there were so many moments in which we met on the conference, like outside the conference, workshop, and there are so many workshops I have attended from this of neuromanual therapy, then arthro neuromanual therapy, and all
spinal
things. Yeah, spinal I have attended. So it's nothing like that, and sir, reality it's well the clinical knowledge what I have gained from sir. I can say that yeah, sir has got the knowledge of all the topics. Okay, it's nothing like, see, like if someone will tell me about, okay, I can say, yeah, I know more, I have got more depth knowledge about the copying, dry needling and taping. Okay, but if you ask sir, sir has got more depth. This is the real scenario. Okay, so we should always respect from whom I am learning. Okay, it's nothing like that, whether I am learning from the students, whether I am learning from my teacher. I always respect my teachers, always respect my students who have attended my workshop. Even I learn from them daily. Today also I am in Bangalore and I came here for my taping workshop. So I asked sir, like, where are you, sir? Then sir called me. Okay, he said, no, I am having one course over there. You come over here. We'll have a coffee and we will talk about that. Okay. So really, it's great.
Yeah.
As a evening coffee is
It is coffee with Kumar. Okay.
And I think sir had made this coffee, so it's really, it's getting wonderful. And what else? Like, I have got so many memories with this sir. Like, so many times, like, we have traveled together for the conferences, for the workshop and all. So it's really a lovely moment. And all the best for the participants today who are attending this workshop. Please do practice it, because though it is online, but
yeah, there was a minor technical interruption. Yeah. It's always great to.
I will request all the participants who are attending it online, please do practice on someone as being model. If you get the person, do use this technique, because it's really very nice technique and very useful for a physio in order to get relief. Like, neuro itself is a very vast topic and very difficult. Personally, if you will ask me, like, I get scared by seeing the neuro patient. Okay, I cannot treat them well. I feel that, okay, I can treat the sports injury patient, I can treat the orthopedic patient, but I really get scared while treating the neuro cases. So it is one of the good technique, and sir will be taking this course. So it's really nice. Like, once I have attended that also. So in Delhi. So wish you good luck, and thank you for the lovely coffee, sir, and thanks for inviting me over here. It's really nice to be here today.
Not just the coffee. I have a set of things to give.
Oh my God, okay. So many things.
So first is the AOMPT badge.
Thank you so much, sir.
And this is a special edition mask for the COVID-19. Okay. This is the pad, and this is the T-shirt.
Oh.
Okay.
Thank you so much for the lovely gifts.
So stay blessed and keep doing your phenomenal work. And globally, I'm very happy that I'm getting positive feedback from you about you, from Sri Lanka, from Bangladesh, okay, from various places.
Thank you so
and
much.
Participants are really appreciating your dedication, that how well you are teaching,
Thank you so
and
much.
your sincerity. They are always looking forward, like, when will be your next workshop?
Yeah.
Okay, so that is the impact that you can create. Okay, so it's always a moment of pride for me to have you here in the center. Okay?
Thank you so much.
Something to do with the technical interruption, internet. Okay, yeah.
So really, it's nice to be the place of your guru. Okay, because I also from beginning only 2005, like 2005 December we met from sir. First time I met with sir in Bangalore. After that, like, it's like almost like 15-16 years now.
And Mangalore is such a place where you meet someone, you get reminded of Mangalore.
Yeah.
Actually.
And like, fortunately we are in Karnataka only. Like, in Bangalore we are sitting right now. I came here for my workshop for 2 days. So today and tomorrow is taking workshop. So really nice to be over here. Thank you so much.
We would also be very honored, actually, this moment to felicitate sir with an award which is specially instituted for sir. Okay, we have not given this award to anybody else before. Okay, and he is the first person who was actually the chief guest in my other workshops. In my spine workshop, sir was the chief guest. So he is again come here. So it is definitely a moment of pride for the AOMPT to felicitate sir with the Physio Leader Award.
Oh, thank you so much, sir. Thanks for the lovely award. Okay. Usually, like, I don't like to go in any award ceremony and all. Yes. I love to get the mementos when I present my like work, when I present my lecture, when I give like workshop, when I deliver workshop. That time, if I get that memento, I really feel proud. So because most of the time people say that okay, ये क्या सारे टाइम को अवार्ड ही कलेक्ट करता रहता है. So that's the reason. But really, this is precious for me to get this award from my guru. Okay. So really this is...
And an award which nobody has got from the AOMPT.
Yeah.
Okay?
So
You are the first person who is getting this.
Thank you so much, sir. It's really great moment for me. Yeah.
Okay. So, I want to ask some few inputs from sir, being another senior colleague and an inspiring personality. Okay, his words will be very, very important that we get some inputs from everyone. I want to ask sir about the recently approved National Commission, the Allied Health Professions Act, because it was like a bill and then it became an act.
Yeah.
So what do you think is the implication that will come for our clinical practice or for our education?
Sir,
what do you
as such, I don't have that much knowledge about that bill or act, okay, because as far as I know, like it was before that it was bill, now it has become act. So act is like a rule and regulation.
We have to follow.
Yeah. So before that, when like I was just listening, I never went through that bill because I never supported that bill. Okay, and I'm not satisfied with that bill. So I never thought to go and read that bill. But few people, those who know it, they say no, it's good for physio. But I feel personally, like I feel really degraded with that bill. Okay.
Because it's all together, although independent council, but
before that it used to be like we used to feel same when someone used to call us paramedics. Okay. And now just the terminology has been changed, healthcare worker. So even a compounder, like in layman term, you can say first aid giver is a healthcare worker. So how can we be a healthcare worker? If we are the healthcare worker, even MBBS people, BDS people, okay, they should be a healthcare worker. So why not they are
under
this bill and this act? That's the main concern.
The National Medical Commission is scrapped very fast because the NCA was pressuring.
Still, people are saying that okay, at least we got the freedom to like do assessment, treatment independently. What was that? Okay. Even before that, we were doing same things. Nobody was stopping us. Like Clinical Establishment Act came, then they also don't know whether it is in import or not. I don't know. I'm running my clinic in Gurgaon, and nobody has came and asked me that whether you are registered with Clinical Establishment Act or something like that. I'm running my clinic since 2013. Before that, it was when I was in government job. That time also I was running a small residence clinic in Kodarma, Jharkhand. After that, I came to Delhi. That time, I started my clinic in that Lakshmi Nagar, East Delhi. And after that, recently, like 2 years before, I have started my center in Gurgaon. So it's nothing like that. I have started my clinic in a small village. Okay, yes, Kodarma, you can see that it was a small place, but Delhi and Gurgaon is not a small place. Still, I am running my clinic, so nobody has stopped me for practicing it. I am doing my assessment. I am doing the treatment independently and nobody has stopped me. As far as I know how to do that, I have been taught, I am doing that thing. That's my constitutional right. Nobody can stop me for that.
And as long as you are doing quality work, you need not be afraid or you need not bend to somebody to send cases. Okay, if you are treating patients properly, definitely cases will come to you.
So, and yes, that's true, sir. Because in my clinic I have seen, I have never tried. Few times I have tried to approach few of the doctors, and sometimes they will tell some words which I don't like. So that's why sometimes I put all my courage to go and meet with the doctors. But after meeting 1 and 2, I felt no, better to leave this. Okay, all. And I am still today, I am getting all like walking patient. None of the doctor they have written okay go to that physio. Only I remember in the East Delhi there was 2 orthopedician, Dr. L. Tombar and Dr. Anil. Both are one of the renowned surgeon for the joint replacement, and they used to refer directly with my name. So that time I used to feel proud. No, really they value the technique, they value the profession. But after that, I never got such people like who do that. Yes, There was one more physician in Lajpat Nagar 3, Dr. Ajay Misra. He used to directly give the number to patient that you please call this person. He will
do the needful
in the proper way, because I have treated him with he was suffering from low back pain since 6 months, and I have treated with needling and cupping, and he was really very satisfied. He said like till now I have met more than 150 physio, and nobody told me like that. Sometimes they used to tell, okay, put this stents. Some used to come with the hot pack, they used to put hot pack and all these things. But you did something different, and my pain got relieved in 2 days. So this is how we build up the like professional relationship. Yeah.
Okay. There was a minor interruption. So even I feel that approvals and inspections,
yeah,
what will happen is it will be corrupted.
Yeah,
because it is government
again it will be government body. Before that it was some of the private body was there who were doing, few people were there who were doing all these things.
I think the state councils were better.
Yeah,
like some.
I feel if we haven't got any like central council, independent council, better state council is more better, instead of just some like just association who is doing all these things. And I feel personally like association is not doing anything. They are happy
compared to IMA,
yeah,
which always protests.
I feel like SM, like they are really happy with this bill and act. I don't know how come, because I know like in our association, like we have personally, I feel like people who have got more than my age experience, and they are sitting and still they feel like okay, it is good for them. Then I should feel the same thing. What to say, yeah. Because I cannot.
But when you talk about association, also people will ask which association. Okay.
Yeah,
so there are so many.
There are so many associations, but yeah, we are not with some big association. One of the largest association who have done lots of things for the physio, by the physio. Okay, so it's just an association of ourselves. Okay, association do things for just association, nothing more than that. Okay, so that is that.
In reality, what is being followed, it ultimately depends upon individual morality.
Yes.
Because whether council tells something also, just for paper we'll prepare, take signature, everything, keep it for documentation, for inspection, give bribe.
The main thing, sir, I can say that I was in UK for 3 years, almost like 3 years. So the main thing I can say, it's not only the association who is responsible, it is we also who are responsible. We physio are not aware. We physio just want something spoon feeding. We don't want to do something. So it's not just the association. Only association cannot do anything. If
even
you talk
council
about,
also.
Even council, if like see, we have got Delhi OTPT council since like I think 10 years. I think more than 10 years. Okay, and nothing has happened. Like people are like they are like 60% quack is working in Delhi.
No action.
And only 40% physio are there. And those 60% quack, they are spoiling all the image of physiotherapy. But council is nowhere.
Only membership and certificate they
give. Only they just give the membership and certificate, they take the money and that's it, nothing else.
College also approval they are giving.
Yeah.
But nothing on the field.
Yeah.
Really.
They should work on field and like on the ground level they have to work for that.
I think that will never happen because in India you see all the fields, the corruption is something which is like a part of the
like I still remember when I was in UK that time, like they have got everything channelized. Okay, if you do a single mistake, okay,
answerable.
That will be answerable and you have to answer in one day. Here, nobody is bothered. If someone has did anything, if I have done some crime, it will be on social media for few days. After that, everything got missed. Nothing, nobody.
Even with the proper evidence, FIR, everything is there. Still, people will ignore.
Yeah. But it's like आया था कुछ हवा आया था हवा चला गया. So that is the thing. So
professionals, we need to be more responsible.
Obviously, we professional have to be responsible for that. Every time we cannot blame the government. Every time we cannot blame the association. We have to be more like responsible.
We should know who is the best, whom we can team up, from whom we can learn.
This is like last time also like we had the IIP election, so at least we should be aware whom to give the like more and everything. But yeah, everything is like everything is everything.
I think if we both are talking, I think so many other things which are
so
which may not be of a cheerful thing for the big people. Okay, so that might come out here.
So it's really, but still, yeah, we have got very good association. I can say that. And
because it's the largest membership. So
yeah, largest association in
WCPT.
WCPT.
The
Like,
World
so
Physio
obviously, like, so that is one of the like best part of the association. Like any association is like
Globally, some names.
globally some names is there. Like at
In
least
between 10 years, we suffered.
Yeah.
What is this?
so at least people are saying that okay, we Indian physio have got also recognized in World Physiotherapy. So that's a good part. Like at least when we were in the UK, that time okay, Indian people are not in WCP. So at least now it's good. So obviously we have to wake up. We have to do something, and still people are doing it. I am not saying that no people are, none of the people. There are so many people who are not associated with the association also. They are also doing lots of things. There are so many people. They have invested from their own pocket and they are doing lots of things for the profession. So we cannot ignore that thing. We cannot neglect those people. Okay. So still, we have to wake up. We have to do something for our profession if we want our recognition. Obviously, self-help is the best help. So you cannot just sit and like spread your hand to give something. Like you have to do something, and if you will do, you can get it. So that
I think basically we need two things. One is to expose the people who are negativity and nepotism.
Yeah.
Okay? We
Yeah,
need to expose them and stop the leg pulling. If somebody is doing some leg pulling for another person, means the first person who is pulling the leg of the other should be actually thrashed.
Yeah.
Okay? Not like part of the gossip and they become
like see, it has become a trend in Indian physio. Like
physio only is suppressing another physio.
yeah, they just think that okay, if they cannot climb the stair, what they think, if I will pull someone from the stair, I will go up. Cannot be possible. Never ever. So don't think in that way. If you want to go up, you have to climb the stair. Don't think that if you will pull someone, you will go up. It's not possible. And people think that okay, they are making master in doing like leg pulling and all these things. They just tell someone, okay, do this, do that from that side, and they will get diverted. We people are not fool. We know everything. We are not sitting just like a fool or idiot over here. We know everything. So it's been like now 34 years of my age. Okay, it's nothing like that. I am just a kid, 5-year kid that I don't know the value of the milk and from how this milk comes. So I know how to like get that milk also. So it's like depends what people think. They have got their own mind setup. They think, oh, whatever I am doing, I am playing mind game, but it's completely illogical. Even we people have got the mind, we play with the mind, okay. And once if we will start playing, it's getting very massive. So I feel, I just want to convey this thing to few people. They try, sometimes they usually try these things. Okay? So not to try this. Not only to
I think both of us have their experience. Yeah. So.
Not only with me, I am telling, like there are so many people. Okay. So people usually, there are so many people, they usually get trapped by all these people. So I think they should, the person who are doing it, they should have some brain, okay. Because everyone has got a brain. We are educated enough. We know what is the reality. Today I was taking 139th workshop today, okay. And I have started taking my first workshop on 15th of September 2017 from a small district Bhadodi. So it's not been like, it's been 3 years something. And I have completed more than 138 workshops, right? So it's not so easy, just in order to tell you. You cannot just pull someone's leg and you can go up. You have to work hard. Yeah, if you are working hard, you can go beyond me. You can still talk, okay. I might not able to reach that talk, you can reach if you will work hard. So it's nothing, it depends on your capability, how much you are doing it. So that's the thing. So that depends. I still remember I used to tell you, sir, that like when you started workshop, that time I told you, sir, it's better you should start taking it on regular basis, and you have started taking in that workshop in Delhi. That was the first time you started taking.
Yeah, 2018.
Like 2018, you have started taking the regular workshop. Before that, you used to take in college and all, then conference lecture, all these things. But a complete like workshop, you have started from Delhi only maybe.
Yeah, right.
So I still remember that. So it's nothing like that. We do remember the things. We collect the memories. Really, it's lovely. So what else can be said to others? Be happy. I can say only that.
Yeah, be happy and be positive.
Yeah, be positive.
And promote everyone. Automatically success will come to you because you are giving the success to everyone. Okay? So that is what I believe.
Yeah, that's the best part, sir. That's really best part.
Because it comes to you because it knows that from your hand it can reach many people.
Yeah.
Okay? So it's automatic. And really wish him the best. And the profession of physical therapy itself is actually proud to have people like this. Okay? So without taking much time from sir, I really wish him the best of luck. God bless him and his beloved family. His family of physios also. Okay? Everyone should be blessed with
thank you so much.
The positivity, so that we all keep working together and keep getting better and keep making the world also a better place. Okay?
Thank you so much.
So good luck to sir.
Thank you so much, sir.
We have violated all the COVID norms, okay?
Yeah.
So that is the thing which actually as a disclaimer I am just telling you, okay? If anybody is thinking that why are they not wearing the mask, okay? And we are also shaking hand actually, we hug each other also, okay? So either way, that's apart from the lighter side. So thank you for all the participants and the viewers who are watching this live. And also I recommend that AOMPT members should understand that they will get all that benefits of discount of the courses, okay, as a partner association. So as ePluris members also will get under the AOMPT, okay, and AOMPT's members also will get discount in the ePluris courses, okay. So don't forget to even contact me for registering in sir's courses, okay. Or directly when you are contacting sir, please mention the AOMPT membership number or your membership certificate. You just have to send him so that he will take care of the rest.
Yes.
Okay, when you are registering for sir's courses. Okay, and don't miss learning from the real passionate student. Okay, so that's important here.
Thank you so much, sir.
So good luck to sir.
Thank you so much, sir.
And just to belated Holi.
Oh.
So for that, because usual skeleton and usual things, it is for usual people. So I am giving this to felicitate sir, okay, for the auspicious event of the Holi with the colorful skeleton. Okay.
Thank you so much, sir. It's really very nice color.
Okay.
Really good. So
I'll just change the camera. Yeah.
yeah, so it's really very beautiful color coding and all these things. Lovely skeleton actually, yeah.
Okay. So it will be useful for sir's education also.
Yeah.
And whenever he takes the picture with the skeleton, he can think that Senthil sir gifted this.
Yeah.
Okay. So it is always nice. Okay.
Thank you so much, sir. Thank you for the lovely gift. Yeah.
Good luck, sir.
Thank you.
So I close this session.
Yeah.